that you want to share, then YouTube is a great place to be sharing them. And actually, health content demand is growing significantly on YouTube as well. As Emma said, we've had over 3 billion views of health videos in 2022 in the UK alone, 110 billion globally. And there are sort of over 1 million health videos from UK sources available as of December 2022. But not all of that content is coming from expert sources. And that's what we're working hard via the various partnerships that we've got to do to sort of bring more of this authoritative, high quality content from experts onto the platform. So just a couple of other stats from third parties. There was an Edelman study earlier this year, which showed that pre versus post pandemic, there's been a 3x increase in the amount of people based on this survey who want to educate themselves about health issues, and also a 3x increase in the amount of people that want to verify whether the health information they see is true or not. And that's, a lot of our work is around that verification piece. So there's also been a third-party study of 160 or so clinicians showing that 93% of those clinicians surveyed thought the video content is very helpful for patients, and that YouTube was the #1 video platform recommended to patients by clinicians for health information. So that QR code will take you to the full results of this study. There's a lot of interesting data there, independent of YouTube related things. So it might be interesting for you guys to look into that and see some of the findings of that study. So in terms of YouTube Health, our mission is that we're basically dedicated to making high quality health information easily accessible to everyone. So the everyone piece we've covered off by some of the numbers that I've shared about how many people across the UK are using YouTube. High quality is sort of what we're going to talk about in the next few slides, and how we're trying to create an environment where the highest quality information is raised up. And then we also want to make sure that content is easily accessible to everyone, regardless of which language they speak, which community or ethnicity they are coming from. So, there's two main ways in which we're working to create a high quality platform. One is that we're removing misinformation. And so recently we launched a new very broad and comprehensive medical misinformation policy. And so that covers all health misinformation in all health conditions across prevention, treatment, and denial. So it gives us a very broad remit to remove misinformation from the platform very transparently and objectively. And then we're also looking to raise up high quality content. So for example, if you search for a health topic on YouTube now, such as breast cancer, at the top of the search results, you see a shelf labeled from health sources. So that contains videos coming from authoritative sources, such as NHS organizations, health charities, and individual doctors like Dr. O'Donovan. When you click on one of those videos, you then see a label against that channel, which highlights the context for the credibility of that video. So for example, we've got from a licensed doctor, from a channel with a licensed health professional, we've got from a licensed psychologist, from a licensed nurse as well. And this work has been underpinned by a partnership that we've got with the Academy of Medical Royal Colleges and NHS England to define health information principles. And so if you look on the AOMRC website, you will see this paper from May 2023. And we've used this paper as part of our eligibility criteria for the health features that I have mentioned. And the AOMRC worked closely with a range of other stakeholders for this work, such as the GMC, NHS England, and Patient Information Forum, and various others. So in terms of the impact that this can have, this is just an example from the NHS 24 channel in Scotland. Once they were included into the health shelves, which is where you see the green arrows pointing, there was then a clear uplift in the number of views of their content because that was entering the health shelf. So it basically just raises up some of that content of yours, helps give it more prominence on the platform. These health features are now available globally. So it's language-based, meaning, for example, if you're a user or viewer in Nigeria and you're searching for diabetes in English, a health shelf may trigger with content from UK sources. And so the content that you're creating here, once it's part of the health features, can be included in pretty much, can be surfaced in pretty much any country in the world when people are searching in English. And in terms of how do you get into these health features, be part of these health features, the eligibility criteria are that you must self-attest against the Academy of Medical Royal College content principles. You have to be a licensed and actively practicing doctor, nurse, or psychologist, or an organization that has one of these individuals attached to it. Your YouTube channel has to be focused on health education, and you need over 2,000 hours of watch time over the past 12 months. This QR code will take you to the application form in case anyone sort of is meeting those criteria and would like to apply. I should say that all NHS organizations are automatically included in the health features. And therefore, if you are an NHS channel creating content, you may see some of that content appear in the health shelf. Now, of course, it depends on whether the title of your video closely enough matches the viewer's search query and whether you've got a decent number of views on your video in order for it to appear relative to all of the other content, authoritative content that it's competing with to be part of the health shelves. So what does this all mean? So this health content leads to really meaningful real world impact. So for example, you see the quote on the top from one of the videos from Dr. O'Donovan about bowel cancer, where it says, if it were not for one of these videos, I would not have got myself checked out. So you know, that clearly shows you the impact that you can have with this content. And then the NHS on their community tab on their channel have got a run surveys on some of their videos. So they did a video again on bowel cancer, and they asked whether viewers felt that video helped them better understand how to check for symptoms of bowel cancer. And you can see sort of from this survey, at least 83% of people watching that video felt it did help them. Look, the YouTube channel can also be a launchpad to create wider impact. This is more for individual content creators as opposed to organizations, but a lot of our clinician creators on YouTube have then gone on to publish books, which will help many more people. They've gone on to release apps such as the blood pressure monitoring app from Abraham the pharmacist, one of our creators, and also podcasts that Dr. Curran, for example, has partnered with Sony Music Entertainment on. So there's multiple ways in which you can use YouTube as a starting point to then create impact in other areas. In terms of some creators on the platform, individual healthcare professionals to take a look at for inspiration, there's a few who've reached the 1 million subscribers mark. So there's Dr. Julie Smith, who's doing a lot of mental health content, Dr. Curran, who's dispelling medical myths, Dr. Simi, who's creating a lot of women's and skin health content, and then you've got Geeky Medics, which is a medical education platform for medical students and doctors. You've also got some of these channels on the right side, which have crossed 100,000 subscriber mark. You've got Dr. O'Donovan, Dr. Khalid Zalmay, both of whom are GPs. You've got Dr. Vic Veer, Mr. Vic Veer, who's an ENT consultant, and various others as well. So these are just some channels for you guys to maybe check out to get some inspiration and see what seems to be working on YouTube in terms of health content. I talked earlier about making this content easily accessible. And so we're working on an AI-powered dubbing solution, which will allow you to translate using the AI technology, your video from English into Spanish or Portuguese, and we're working on Hindi and Indonesian. So this is currently in a pilot phase, but we're looking to then roll this out next year to all channels, and hopefully we'll have more and more languages along the way. So this video, unfortunately, is not going to play with any volume, so I am going to move past that video. So what we're also doing is raising up the stories of lived experiences from patients. And so in 1 or 2 weeks time, we're going to launch a shelf which is labeled personal stories. So if you search for topics such as living with anxiety, living with cancer, at the top of the search results, you see the shelf which is labeled personal stories. So that contains videos specifically coming from lay people talking about their experiences living with a condition. So you've got a couple of examples here. The Aspie world is an individual's talking about his experiences living with autism. And then you've got Mr. Colitis Crohn's talking about his experience living with a stoma bag, living with colitis Crohn's. You've also got the NHS channel, which has got a great My Story series, which is shining a light on patient stories as well. So I'm now going to transition to just talking a little bit about YouTube content and sort of the best practices for creating that content if you wanted to set up a channel, or if you've already got a channel, you wanted to grow that channel. So, before you get started, I always tell people YouTube is hard and it's a slow burner. So unlike maybe sometimes what you see on TikTok or Instagram, where if you put content on there, it can sort of become an overnight success. That just won't happen on YouTube. It takes a lot longer. However, YouTube is also a place where content never dies. So you can have long-term impact and build an engaged community, which is valuable on and off platforms. So you've got videos which are several years old, still extremely successful on YouTube, because you get a lot of value over the long term for the content that you create, and you can also build up a community and can have that engagement with your community that you can't have on other platforms. So this advice is more for individual creators, but it's about playing the long game, taking breaks when you need to, and actually having fun with it, because that's what makes it sustainable. Because you won't see the numbers of views go up over a period of months or even in the first year or two. It just takes a bit longer than that. So when you're starting out on YouTube, it's really important to sort of find your why. So think about what your reason is, what your objectives are for starting your channel. Who's your ideal viewer? What do you want your audience to take away from your content? Is it a certain call to action? Is it a certain set of instructions that you want them to to then enact in their own lives. And then also think about what is your spiky point of view? What is the unique leverage you've got? Because there is so much content on YouTube. So there's no point you duplicating what already exists, even if it's from a different channel. You won't be visible on the search results. So try and think about what angle you can bring to the table that is different to everyone else and will allow your content to stand out. So once you've figured out your why, then you need to figure out what types of topics you want to create content on. And so Google Trends can be really useful for this. If you go to the Explore section of Google Trends, you can then search for certain health topics, and you'll see related topics, you'll see related queries and how popular each of them are. And what you can also do is once you've selected a topic, you can search for certain subtopics for that topic area and compare each of those subtopic terms and see what the interest has been over time. And you can toggle this section so it's UK specific and so it's YouTube search specific as well. On Google Trends, you can also go to the Trending Now section where you'll see daily search trends. That's not health specific, but you will often see health topics on there, and that gives you a really good steer in terms of what people seem to be searching for on Google, and therefore what type of content you might want to create a video on in the next few days in order to address that search demand. It's also worth leaning into current events. So on the YouTube platform itself, there's a trending section where you can see all of the different videos that are trending. Again, not health specific, but may help you get an understanding of what types of things are popular. And you might want to use some of those videos as hooks or relate to some of these videos when you're creating your own content. If you type in a health topic, then you will see the autocomplete show the most commonly searched subtopics or subqueries for that particular topic area. And this is dynamic, ever changing, so it's worth keeping an eye on. And you can then also navigate to the news section. A lot of people are using YouTube to consume news content. And so you can see if there's any health related stories in the trending news section, which you may then want to create some content on the back of. Once you've figured out which topics you might want to focus on, it's important to try to experiment with different format types. So you've got things like reaction videos. So if there's been a very popular show on Netflix, for example, which has got some type of health angle or health related scene to it, then it can be very fruitful to sort of say, well, let's look at this scene and let's break it down and tell you what is medically accurate and what is not medically accurate about this scene. You could also, as I said, sort of focus on medical news, what's popular in the news. You do collaborations between different people or organizations to sort of cross-pollinate your audiences. You can use animations, especially important for those with lower health literacy. You can also do a Q&A format. So if you've got a clinician who says, well, here are the top 5 questions I keep getting asked about this topic, you can flash them up on a screen and have that clinician onto them on the screen. And this can also work quite well as a live stream as well. So in terms of the metrics that matter on YouTube, you need to think about your title and your thumbnail as a starting point, because that's your shop window basically for content creation. For content discovery. So most people are going to find health videos by navigating via search. So if they enter a health topic into search, they then are presented with a series of videos on that search results page, and they are then going to look for the titles and the thumbnails that most appeal to them. So this is really important. And, you can measure your CTI or click-through rate depending on how likely it is when people see one of your titles and thumbnails that they actually click on it. You then need to see, once they've clicked on it, what is the average percentage of view duration? So how much of that video are they actually watching? And so that will then tell us and tell you how engaging that content is. And so the ultimate metric really for a particular video is the watch time. So how much of that video, how much are people watching that video, basically. Authenticity is really important. This can be a bit harder for organizations sometimes versus individuals, but if you are an organization, you may want to think about getting 1 or 2 of your more lively or kind of energetic clinicians in front of the camera and running a series of content with that particular individual, so that there is a little bit of personality of theirs that can be shared on the video, on the channel, and it just makes everything much more authentic. So there's no need really for high production value with very expensive equipment. You can keep it quite low key, and actually that makes it more relatable to the viewer as well. So some few tips in terms of for keeping viewers engaged with your content. It's important to get straight to the points. You should skip introductions that don't share new information. So it isn't so helpful to say, hello, my name is X and I'm from Y clinic and I'm going to talk to you about Z topic today. Instead, just say, did you know there's a new COVID vaccine? and it's now available for these different groups. For example, get straight to the point. That's what people want on YouTube. Keep your video focused and make sure all of the content aligns closely with your video title. Otherwise, people will feel like they've been shortchanged by clicking on your video. It's really important to focus on the audio. So actually, you can use your phone and get really good video quality, but I would recommend buying a very, very simple camera, a microphone, even a £5–10 microphone, plugging it into your phone. It will make a big difference to the audio quality, and that's really important when you're trying to engage an audience. For longer videos, it's important to consider chapters. So you may want to split a longer video up into the 4 or 5 key questions that are being asked, and then each of those can be a chapter. And then eye contact is really important as well. So really important to face the camera. So this side-on angle that you sometimes see in sort of TV interviews is just not very engaging on YouTube. So it's really important that you're actually facing the camera, because that's what viewers are expecting and wanting. I talked before about thumbnails. So here's just an example on the screen of 4 really high quality health related thumbnails. So you can see what's really good about these is that they use a combination. There is a very large font of text, and there isn't too much text on any of these thumbnails. They use really good contrasting colors. You see the black on the yellow, black on the yellow on the black, and you see the white on the black, for example. And you can see that the images make it really clear what the video is about, even if you don't speak English, for example, or you don't speak English that well. And the colors really pop and make it. And the other thing is, if you include a face on the video, that can often be helpful in terms of engaging the viewer and making it more relatable to the viewer as well. So these are just a few tips in terms of how to optimize your thumbnail for the videos that you're creating. In terms of sort of how you think about the content you create, we often talk about the hero, hub, and help model. So your hero content is a content that you produce only occasionally, that's got really high production values, and it basically takes you quite a long time to make that video, but it will hopefully have quite a broad appeal. It's the type of thing that may also run as part of a TV campaign. It's the sort of thing that's going to appeal to a wide and varied different audience. But your bread and butter content is probably going to be your hub and help content. So help content, this is when someone has a particular search query, a particular question about a health topic, and you create a one-off video to address that health topic or that question. And then you've got your hub content, which is where you take a topic and you say, actually, I'm going to serialize it, and I'm going to create a set of 5 or 10 videos on this particular topic. And that way people keep coming back to your channel for more. And also your channel becomes known as a hub for X topic, because you have a good series of videos on that topic. And so that hub content is really important to sort of encourage repeat visits of your channel and subscriptions of your channel as well. So I'm just going to talk very briefly now about shorts. So shorts have really taken off in the last year or two, thanks to the advent of TikTok, and we've now got YouTube Shorts. And so actually, on a recent survey that was done by a third party, it's found that 70% plus of those watching videos online are regularly watching short form video. So it's really important. And actually, the really good thing about short form video is that it's a great way to get started with your channel, because via the YouTube app, it's so easy to create a short. You just hit the create button, you start filming, you can then add any audio you like to that video clip. And actually, you've got access to all of the various different chart topping music tracks, free, license free for shorts. And so you can add the music in, and then very easily you can add in a green screen, you can add special visual and sound effects to the short as well, and then you can basically upload it onto your channel, and you can sort of repeat that for a variety of different topics. So it does give you a chance to cover a lot of topics quite quickly. And then just finally to say, there are a few channels to check out in terms of health shorts specifically. So Dr. Julie, who I mentioned before, has got some really good shorts on mental health. You've got Abraham the pharmacist, who's got some really good content on his shorts. You've got the NHS channel, which has got really good shorts as well. And Dr. Curran has got some short dispelling medical myths, which are very engaging. This was meant to be a video of an NHS short about breast cancer, but I don't think it's going to play, so apologies. I think that, okay, fine, it's going to play without the video, but that's fine. Just without the audios. It gives you an idea. You know, the NHS have basically been able to be a bit more informal with their shorts content versus their longer form content. They've been able to pop up these images on the screen and using this wiggly hand, and then have this sort of handwritten notebook text at the end. So you know, it's quite an informal style, but it's been really engaging and successful for the NHS team. I'm going to leave it there and sort of see if there's any questions that anyone has on anything that I've presented.
Thanks, Vishal. That's really insightful. And I guess really what a huge impact this can make and make a difference in the UK for people who sometimes can't always access healthcare services, and they've got that there ready and waiting. So I'm just looking in the chat. We had a question from, hi Angus, how are you? Are you there, Angus?
Hi, Emma.
Oh, hello.
I'm very well.
Yeah, you were the first to post a question in the chat. I just wondered if you could just expand quickly, if that's okay.
Yeah. One of the problems with the internet now is there's a lot of false information on it. And David Kidney and I are both slightly concerned about the fact that people can go onto YouTube, publish material which may or may not be accurate, and then influence the general public. So the question, Vishal, is how does YouTube monitor what is being put on its channel, and what is its legal obligation to the general public?
So no, it absolutely does monitor. I can't necessarily address the second question in terms of legal obligations, but in terms of what we do for misinformation on the platform, we have a very robust system that will basically review every single video that's uploaded onto the platform, whether it is health related or not. Those videos will be reviewed by a combination of the algorithms that we've put in place, as well as humans in the loop, and for health content, it's specifically medical doctors in the loop. And so we will be able to pick up any blatant misinformation very quickly, typically before it's even received a single view. And that video will then be removed, and that channel will be informed, and we will then obviously keep an eye on that channel and other content that they upload subsequently. The way that we do that is via the misinformation policies that we have in place, and so if there is any content which clearly violates those misinformation policies, that is when we can take action. Where we have lower credibility, lower quality content, which is maybe not citing an evidence base, for example, but isn't necessarily clear misinformation, that content is not necessarily removed from the platform, but it will be superseded by this high quality evidence-based content coming from experts that I've been describing, that we're kind of filling up the health shelves with. And so the idea with the health shelves is that it helps us to sort of helps all of that content to sit above anything that's lower quality, lower credibility, whilst at the same time making sure we remove anything that's blatant misinformation. So that's the sort of approach that we take to try and maintain the quality on the platform.
That's helpful, thank you. And just for your information, I've moved on to using an Anchor Bluetooth speaker microphone, which has made a difference to the way I communicate using the web.
Yeah, no, interesting. Yeah, absolutely. So I think that a microphone, an actual proper microphone, can make a real difference to the sound quality, because what the phones are picking up is just not very good quality, whereas the video that the phones are picking up is actually quite good quality these days. Yeah.
And Vishal, just to follow on from that, I guess really you don't really need to be a technical wizard to kind of have your own setup.
No, not at all. I mean, there are so many YouTubers, even very large ones, who are still using their phone to film, to be honest. And actually, it gives you a lot of advantages, because you can be a lot more on the fly and ad hoc with your content. And as I said, it's that informal style that often works, but it's also consistency which works. And so if you've got your phone with you everywhere you go, you have the chance to create content everywhere you go and then upload that more frequently, versus saying, oh, well, I have to be in my studio, I have to have my high-end 4K camera, and oh, I'm on holiday these 2 weeks, I won't be able to do it, that type of thing. And so yeah, absolutely, I think that you can be quite scrappy with the equipment that you use.
Yeah, no, that's great. Thanks, Vishal. David, do you want to just mention your question around charities and other providers?
Hi, Vishal. I was just wondering about it's clinicians who post, and I was wondering, like big charities, presumably they have clinicians attached to them, but can a charity post direct, or do they have to go through a clinician?
Well, the way it works for the health, so anyone can post on the platform. So there's lots of health charities that have got content on YouTube. Specifically in terms of the health features, there's quite a few health charities that are currently involved. So Cancer Research UK, Macmillan, Diabetes UK, you've got Blood Cancer UK, you've got colitis, Crohn's colitis UK, so quite a few charities. And what we do require is that you have a healthcare professional associated with your channel. And so for most of them, they've either got someone in-house or they've got a freelancer who's reviewing their content, and they will then submit the details of that individual as part of their application. But there is no hard and fast rule about how that clinician needs to be involved with the organization. So for most health charities, they found a way to make themselves eligible for the health features.
Great, thanks.
Okay, Louise, you mentioned in the chat that you just wanted to hear more about the specialist areas. I don't know if you want to expand on that.
It's just about validation, really. It kind of hitches onto what David was saying about validation and reliability and source. And when you look on YouTube, there's such a great vast difference between people who are talking on there, and it's quite unclear as to how valid what it is that's being said. So I would feel a bit strange. I mean, I'm 48, so I'm not as young as the children that are really keen on using this stuff, but I would feel a bit uncomfortable and wary about what I said and the implications of how things can be misinterpreted. And
so, just so I understand, do you mean in your role as a clinician, as a voice of influence, or is that kind of?
Yeah, as a voice of influence, really. Yeah.
So I mean, I think that's always a consideration for clinicians, and that's why
having spoken on the radio, for example, the first things that were said to me was, be careful what you say because you don't want to frighten people. So we each have our own perspective, and everybody doesn't have the same shared perspective, and it's quite easy to shake up a storm quite innocently. I just wondered your thoughts on that, really.
Well, I mean, I think that the advantage that YouTube has is there's space for every different perspective about a topic. So unlike the radio or TV, where they'll typically get usually one person or two people, for obvious reasons, you can't have a segment for 1 hour answering every sort of topic that they want to cover. So they'll get one or two perspectives, and that suddenly becomes the truth that the viewers latch onto for that topic. On YouTube, it's very much the case that if people are interested in breast cancer or prostate cancer, they will look at lots of different videos about it. Actually, very few people will just look at one video, and so there is scope for all of the different perspectives out there. And as a clinician, I guess that you do have to be mindful of what you're putting on the platform, but that's why I think for us it's really great to be able to work with clinicians, because they are so careful about the content that they create, and very rigorous about the approach they take to creating that content, so that the end result is something they'd be happy with now and 2, 3, 4 years later as well. So yeah, I think you're right. You have to be careful as a clinician, because you are then going to be an influential voice on the platform. But I think equally, you can assume that people are consuming multiple different angles and perspectives on that topic. So what you say isn't going to be the only truth that people subscribe to on the platform.
Thanks, Vishal. Just got a quick question for you, actually, around sort of the preventative measures around health, and I guess really public health. I guess this could be a powerful tool for, preventing, some conditions and some diseases as well. So I'm just wondering, is there scope long term to kind of have some form of integrated kind of platform with some of these departments in healthcare?
Yeah, do you mean in terms of integrating the content into care pathways, for example, to help?
Yeah, so for example, it's all, David may be able to elaborate on this, as he was a lead for public health in the West Midlands, but I guess getting the information out to people around what they can do to help, prevent things from happening long term, so it doesn't get to a particular point, where they need clinical attention, can we get that information out to people, as a platform, so it doesn't lead to sort of disease?
Yeah, no, sure, absolutely. So I think that we are trying to figure out ways in which we could inject the content that is on YouTube into care pathways. So we're working with, for example,
Yeah.
Cognitant and eConsult to say that can this content effectively be prescribed to patients and tailored to their needs. That's, I suppose, something where we would then lean on the NHS and other third parties to execute.
I think
on that,
so.
because what we have got is the platform that hosts a wide variety of content, doing what we can to put some type of markers of credibility and validation on that content. But it's then a case of our clinicians pointing either their patients to YouTube to access that content, or our clinicians then sending a specific link to a video to their patients. And obviously we're trying to encourage more and more of that, but it will become more of a thing for the NHS to advocate for, which they're starting to do in certain places. But yeah, hopefully we'll see more of that. Maybe in due course on the NHS app, we'll start to see some of these YouTube videos embedded as well.
That'd be really good. I mean, I'm just thinking, people go to a GP and they're handed a leaflet. And, and a lot of the time leaflets kind of just get left, and, there's nothing better than actually visually seeing, social prescribing, for example, how people can look after themselves a bit better. So, yeah, thanks, Vishal. Is it Athlete Hardy? Are you a dental student? We lost him. Okay, so what I've got here, are there opportunities out there for dental students to grow their audience and make content? So would dental students be considered a health professional? Is that right?
So at the moment, we've only opened the health features out to 3 professions, but we're definitely looking to increase that over time, because obviously there's a number of other professions that are regulated in the UK and therefore would be sort of sensible for us to incorporate into the health features. So, dentists would definitely be one where it's mandatory, or it's a mandatory requirement to have a license to practice. And so it makes it quite easy for us to say that we're going to check whether you've got the license or not. So, we definitely look to include those additional professions in due course into the platform. In terms of students, they at the moment would not qualify because they wouldn't have the license to practice yet. That doesn't mean that they can't create content on the platform, of course, and have their content visible. And there's actually lots and lots of medical students creating content on the platform. Typically, I would say more on lifestyle topics. It feels like once they graduate and become a doctor, they feel more comfortable creating actual health education content. So I would say that it's definitely good for students, and a lot of students are starting to build out their YouTube presence. But what they're then doing is transitioning from lifestyle content, entertainment content, to more health education content once they actually qualify, at which point they can also be eligible for the health features. So yeah.
Does that help?
Yep.
Yeah. Oh, good. Okay, so I'm just seeing if there's any more hands up in the air. I don't think so. Okay, well, Vishal, that's amazing. Really great. We're really honoured to have you come and talk to us. So I guess long term, it'd be good just to keep an eye on things in terms of how you're progressing. And obviously, we'd love for you to come back anytime to the cluster. And obviously working with some of the NHS trusts in the region as well. We'd like to hear some good case studies in the region as well, so we can help support the narrative for the UK. So yeah, just keep in touch, Vishal.
Yeah, no, absolutely. Thank you for your time, everyone, and happy to chat again anytime.
That's great, thanks. Vishal, could I just ask you to stop sharing your screen, if that's okay? Thank you. I'm just going to pass over to David Kidney just for a quick update.
Hi, everyone. Happy to tell you about what's going on at the cluster at the moment. 2 things to say right now. One is that the Combined Authority has asked me to do a project on seeing whether all the stakeholders in health tech in the West Midlands want to get together and agree a single strategy or vision statement that everybody could agree to sign up to, and it would guide our future work in the sector. And the next stage of that, after doing some research, is a roundtable in October, followed by some drafting work from me, which will get very wide coverage for people to contribute to. And then the second thing is the very, very successful Birmingham Tech Week, is going to be upon us in October. And for the second year running, we've been asked to run a dedicated health tech day on Thursday, the 19th of October. We've got a great program down at Enterprise Wharf, part of the Bruntwood development, just by Aston University. And Mark can send you details about how to register for that. So kind of two really important things happening in October.
That's great, David. Thank you very much. Quick update. Okay, so I think that's pretty much it. Yeah, thank you very much to everybody for joining us, and we look forward to seeing you at Tech Week if you're coming. If not, we'll see you at our next TT. Thank you, everybody. Bye. Bye.
Bye, Emma.
Bye.
Thanks for everything. Thanks, Michelle.
Thank you. Thanks, everyone.
Thanks, Michelle.
Thank you.
Oh my
All
God,
good?
it's just you and me, Emma.
I know.